This is a brief talk to explain a system of screening and management of concussion that can assist with the recovery process. Most Australian sporting codes are now familiar with the Concussion in Sports statement, and most codes have developed their own specific guidelines on concussion management. The common themes among all of these are, firstly, that we must recognise and remove players who have a suspected concussion at any level of competition, that a doctor should be involved in the assessment of concussion, and that return to play decisions should be made with a medical doctor and preceded by a minimum period of relative rest and a gradual return to physical and mental activities. CCMI is a concussion management platform complementary to these guidelines that helps doctors and other health professionals standardise assessment and management of concussion. Doctors and physios offering this service need to complete a very comprehensive dedicated course that takes over 50 hours and requires regular examinations and recertification to ensure clinicians stay up to date. Baseline testing is a core component of the program. The screening protocol takes about 30 minutes to complete, and it also includes a computerised neurocognitive test called the impact test. All of this gives us the proper breadth of information to ensure you return to work, learn and play firing on all cylinders. There are three main points from this talk. Firstly, the reason we recommend annual screening in concussion management is that there's more information to guide diagnosis and safe return to play. Secondly, our approach to concussion treatment is an active one, not a passive one. So in this case, we gradually upgrade activities after a short period of relative rest. Now, even if your sporting code has a mandatory stand down period, for example 12 days in rugby union, that doesn't mean you need to sit in a dark room and wait 12 days before you can move and think and get and gradually recover. Now finally, during this time, we actively monitor your stage of recovery and communicate that to you, your physio and coach, with the goal of getting you back fully recovered. As a sports physician, I've seen too many patients, including elite athletes, who have had concussions that have plagued them later on, not only affecting their sport, but other aspects of their life outside of sport. Now, believe it or not, your brain is your biggest asset, no matter how intellectual or unintellectual you are. It determines everything about you. Everyone who plays a contact sport is at risk of a concussion, and the rates vary among different codes. But in rugby union, for example, it's about 10% of players per year who will suffer a concussion. And while most of these will resolve within a couple of weeks, about 5 to 10% of patients will go on to suffer prolonged symptoms that can affect their lives profoundly. Now, even though there are no guidelines mandating concussion screening, it's clearly ideal for athletes at risk of concussion to have baseline tests to help guide the diagnosis and safe return to play. Despite how common head injuries are, and it can be up to 30% in certain sports, having completed my degrees in both physiotherapy and medicine, I can attest to the fact that unfortunately it's not well covered in any healthcare curriculums. This might have changed now, but it still doesn't seem to be receiving enough attention and formal education for health professionals. Now, the research shows that one concussion is not such a major problem in terms of long-term effects, but a second concussion prior to full recovery from the first has been shown to cause potentially permanent and in some very rare cases fatal brain damage. And worse still, only 10% of concussions are easily identifiable, as in they involve a loss of consciousness or loss of responsiveness for the player. So 90% of cases we do find more difficult to diagnose and rely on the patient or the athlete to tell us something's not right. And this is why we have a fairly dismal rate of recognition at about 50%. And a clear priority is the education of players and support staff to help pick these up quickly and treat them before a second head injury occurs. Now, unlike a fractured leg or a dislocated shoulder, concussion is not a visible injury. It's a functional rather than a structural injury. So it's a lot like dropping a laptop if you think of your laptop as your brain. And when you look at your laptop, the keys are okay, the screen's okay, battery's okay, all the hardware's fine. But it's a bit slow and clunky and some of the software isn't working. Now, a concussion works in a very similar way, and thankfully most concussions, the software reboots and you go back on with life without too many problems. So, unfortunately, because it's not a structural injury, it can make it very hard for others to appreciate that you have a problem and that you're not ready to go back to work, school or play. Our philosophy as sporters and exercise physicians is to ensure that we're thorough and comprehensive in getting your recovery right in the first place. We want to get you back and keep you back in the activities of your life with the ability to enjoy your sport as well. And to do this, it helps to know all about your software, that is akin to the computer analogy here, via baseline testing. Now, baseline testing helps us understand what's not working and how to then target and treat those areas that are not working on your operating system. So whether you're in a professional team or you're an amateur, most of us have other commitments outside of our sport, and it can be very hard because of all of these other areas to keep track of your recovery. And one of the best things about this platform is the ability to communicate with multiple parties through the Concussion Tracker app. So this helps us educate everybody involved on the stage you're at in your recovery, and it's a stepwise approach that includes other aspects of your life, not just your return to sport. So you can see the list of restrictions and the allowed training drills and exercises you should be doing at each stage, and you can also report your symptoms to provide feedback. Now, the Concussion Tracker app is also helpful for support staff to be able to get you in for early medical follow-up. So here's the comprehensive list of all of the areas we test during our baseline testing. And when this is done yearly, it really helps take the guesswork out of managing concussions. To this day, there is still no single test that is valid and reliable to identify and treat concussions. So we rely on all of this information to help guide our decisions around diagnosis, treatment, and safe return to play after a concussion. So after a head injury, we'll assess you and we'll work out exactly what your issues are. Kind of like finding out which apps are and are not working on your operating system. And then we work collaboratively with accredited rehabilitators to help you gradually return to work, learn, and play. We call this multimodal management, and the research shows that early targeted treatment with this approach can improve recovery. Now, the main reason that concussion guidelines all support what's called a graduated or stepwise approach for activities and for recovery from concussion, and this tends to be at least 5 days from the time your symptoms have gone away, is that there is evidence it takes a long period of time for the brain to recover, even though symptoms have gone away. Now, computerized tests have shown that at the 7-day mark, as many as 20% of athletes in this particular study still had impairment of their reaction speed or their cognitive tests on their computerized testing, despite all of their symptoms having gone away. And what we know is that early return can lead to problems with awareness, reaction speed, and this can then lead to other injuries, either another head injury or particularly lower limb injuries. So this is real, and the data is there to show us that, particularly in contact sports like rugby union, as much as 60% increased risk occurs on return from concussion. So as I said, we take a big picture view. We want to get you back and keep you back in your chosen sport, as well as work and study if you're involved in these. Now, the CCMI education platform is also really world-class, and it's very much concordant with the latest evidence-based guidelines. It's for coaches, parents and players who more than anyone need to understand the actual science behind how we're identifying and treating concussions. Now, all of this works within a network of trusted rehabilitators. All the baseline test results, all the concussion medical files, they're secured and they're accessible among a network of clinics of trained clinicians. And that means you can be managed at any location that's accredited, whether you're in Canada or the UK or you're just at home. You can look up a clinician in your area and know that they've done the necessary training and have the skill set to look after you. As I've said, the key there is to ensure that you do have a doctor involved in your management, both diagnosis and return to play. But this excellent network of rehabilitators is definitely a helpful tool that CCMI promotes and allows. I create educational lectures like this to help empower my patients by allowing them to understand their problem, treatment options and expected recovery. I hope you found this useful, and if you'd like to delve into further reading, I'd suggest you visit the CCMI website or my website. Please remember, this lecture is for educational purposes. It doesn't constitute the giving of medical advice, and no patient-doctor relationship is formed.